lors de la lutte contre cette pandémie mondiale. Merci pour tout ce que vous faites pour nous garder en santé et en sécurité. Vous êtes de vrais héros. So, to all of Canada's frontline healthcare workers, we know that this is a particularly challenging time. This is National Nursing Week, and I'd like to thank all of the
Now memories. They'll share their understanding of the power of their nurturing. So my weekend reflection was on the fundamental human need for this most powerful force of good. Nurturing is that silent catalyst that speeds up the healing of our cuts and scrapes, calms our fears, and gives us reassurance that everything will be okay. This brings me to a very special week of recognition and acknowledgement of some of the other important nurturers in our society, by preventing the spread of life-threatening infections. Then slowly, but with unshakable purpose, she raised the standards and profile of nursing and put an indelible focus on the education of nurses. So in appreciation for the nurturing, daily sacrifices, deep expertise, and unshakable professionalism of nurses everywhere, shine a light in your window on Tuesday night. Thank you. Merci.
Okay. Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard Njoo. Dr. Njoo, s'il vous plaît.
Merci et bonjour. Comme d'habitude, je vais commencer par vous donner les derniers chiffres sur la COVID-19 au Canada. Il y a maintenant 69 156 cas confirmés, dont 4 906 décès et plus de 32 400 personnes rétablies, soit 47 %. Jusqu'à ce jour, des laboratoires partout au Canada ont analysé les tests de dépistage de la COVID-19 de plus de 1 118 000. Environ 6 d'entre elles ont obtenu un résultat positif. Au cours de la dernière semaine, en moyenne, plus de 25 000 personnes ont été soumises à un test de dépistage chaque jour. Ces chiffres changent rapidement et ils sont mis régulièrement à jour dans le site canada.ca/coronavirus. Voilà que nous entamons une nouvelle semaine après avoir rendu hommage à nos mères et à nos soignants et soignantes, qu'elles soient à la maison avec nous, à l'autre bout de la connexion virtuelle, ou encore qu'elles soient ligne directrice, prestations de programmes de santé publique comme la vaccination, à la mise en œuvre de pratiques de prévention et de contrôle des infections et à la contribution à la recherche et à l'innovation. Le personnel infirmier contribue au bien-être partout où il va et nous nous sentons beaucoup mieux grâce à eux. Cette semaine, prenons le temps de remercier le personnel infirmier du Canada en participant à 19 heures à des encouragements à partir de votre entrée, en fabriquant une affiche pour remercier les héros des soins de santé de votre communauté, ou en illuminant une fenêtre en leur honneur mardi soir. Pourquoi mardi? Parce que les infirmiers et les infirmières de partout célébreront le 200e anniversaire de naissance de Florence Nightingale, qui a révolutionné le domaine des soins infirmiers. Cette révolution a eu des débuts modestes, avec la mise en place de pratiques d'hygiène et de lavage de mains pour sauver des vies en limitant la propagation d'infections potentiellement mortelles. Lentement, mais avec une détermination inébranlable, Florence Nightingale a rehaussé les noms et le profil de la profession infirmière et laissé une marque indélébile sur l'éducation du personnel infirmier. Par conséquent, en reconnaissance du soutien émotif, des sacrifices quotidiens et du professionnalisme inébranlable des infirmiers et des infirmières partout, illuminez votre fenêtre mardi soir. Merci.
OK. Merci, Dr. Njoo. Et maintenant, je donne la parole à Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Christia, et bonjour tout le monde. Le message principal du premier ministre ce matin, c'était un message de protection, entre autres en mettant en place un nouveau programme de crédit d'urgence pour les grandes entreprises. Premièrement, protection pour les travailleurs en s'assurant du respect des conventions collectives et en s'assurant du respect des plans d'investissement pour garantir les emplois, même dans la situation de crise que nous vivons. à l'aptemps de la crise, le économique majeur dont on a besoin pour relancer l'économie. Et on sait que ça passe, entre autres, par un plan de prêt d'urgence auprès de certaines de ces grandes entreprises. À nouveau, ce n'est pas un chèque en blanc. Ces grandes entreprises vont, dans la plupart des cas, préférer continuer à obtenir des liquidités des marchés financiers traditionnels, mais dans certains cas, il est possible que ces entreprises fassent appel au gouvernement canadien, mais il va y avoir des conditions importantes à respecter.
En suivi,
oui, j'avais compris. Oui, merci. J'avais compris que c'était des prêts, M. Duclos, mais j'aimerais que vous m'expliquiez en particulier le concret d'une entreprise aérienne. C'est quoi l'intérêt du gouvernement de mettre de l'argent disponible pour une entreprise aérienne? On a vu des entreprises automobiles ne pas rembourser des prêts de gouvernement et mettre des gens à pied au bout du compte. Alors, comment est-ce que ça peut être logique d'aider financièrement des entreprises aériennes quand on sait que à court et à moyen terme, peut-être même à long terme, leurs affaires vont aller en diminuant?
Bon, il y a une chose qui est claire, et vous le dites très bien, c'est qu'à court terme, on sait très bien que ces entreprises aériennes vont continuer de connaître des pertes importantes. Mais ce qu'on sait aussi, c'est qu'à plus long terme, on aura besoin d'entreprises aériennes solides au Canada. Et d'un point de vue structurel et d'un point de vue national, ces entreprises aériennes et de transport en général vont être appelées à jouer un rôle majeur pour de nourrir le tissu économique du Canada. Il serait vraiment très, très dommage, non seulement à court terme, mais aussi à plus long terme, si on se privait au Canada d'entreprises aériennes et de transport plus généralement solides pour un jour là, nous sortir de cette crise.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Ryan Tumulty avec le National Post. Please go ahead. À vous la parole.
Yeah, hi there. This question's for Dr. Tam or perhaps Minister Njoo. I'm working on a story and I've been talking to people in the health industry here about Canada's ability to produce large quantities of vaccine when or if one is found for COVID-19. I'm wondering if that's a concern for you, if you think the resources are here. I know Canada does produce a lot of vaccine, but those markets those factories are already full of other orders.
Well, thank you very much for the question. And in fact, that's part of the work that we've been doing in terms of working with promising companies across the country, particularly when it comes to vaccine production. Certainly, we have a ways to go. As you know, there is quite a bit of work to do in the space of vaccine creation and then production, but that is certainly something that we're working on. And my colleague, Minister Baines, has been extremely active in this space, making sure that Canadian companies who have either the capacity or the desire to do that have the supports from our government to quickly ramp up. Maybe I'll turn to Dr. Tam to speak a little bit more about where the international community is at in terms of vaccine development.
Well, I think we're still in this sort of relatively early stage where there's a lot of research, which is great news. So I would say over 100 sort of different candidates being looked at right now as potentials, some going into sort of early stage clinical trials. So it is still early stage. But nonetheless, we are engaging all the capacities in Canada to have a look at what is in the realm of the possible. So you don't actually have a sort of lead candidate vaccine yet, but we are absolutely monitoring every one of these and looking at domestic capabilities linked to it. So it is a very rapidly...
Tissu, mon employeur, et d'en parler avec les responsables et les experts de la santé publique si jamais cette discussion n'est pas aussi importante, n'est pas aussi satisfaisante que je le veux comme travailleur. Donc, c'est la condition de base, c'est que ces relations employeurs-employés doivent se faire correctement entre les employeurs et les employés. La prestation canadienne d'urgence est là pour aider, appuyer financièrement des millions de travailleurs qui n'ont pas cette capacité d'être au travail de manière sécuritaire, dans le cas des relations que je viens d'expliquer, ou qui doivent prendre soin d'un enfant à la maison, ou qui ont perdu leur emploi en raison de la COVID-19.
Merci, Monsieur le ministre. On va passer aux questions dans la salle, starting with Mike from Global.
Thank you. Mr. Njoo, we just had Mental Health Week, And I'm wondering, how concerned are you about a secondary mental health, like echo pandemic, that could happen because of all this?
Because, of course, people are struggling for a whole bunch of reasons, including our young people. And we need to be all focused at every level of government to help people manage through these difficult times.
Thank you. And you talked about the Wellness Together portal. And I'm just wondering, does it have enough supports there? Do we need to do other stuff? Is there enough funding? Is there anything else we could do better?
So far, I've heard good things about people.
My first question is for Mr. Hajdu and Dr. Tam. Schools in some areas of Quebec are opening today, even though the numbers there are still relatively high. How concerned are you that kids right now are going to be used as guinea pigs in this reopening that we're seeing, and does that concern you?
Well, I think as we've all said, and all the chief medical officers agree, you have to do things slowly and cautiously. So I think I know that public health domain, people are concerned that closing down schools can only impact those most vulnerable the most. So those are the kids, I think, that they're most seized with. The other thing is that children of essential service workers as well that need maybe some support from a school perspective.
Minister, how did you have anything to add?
I think Dr. Tam's covered it well. Thanks.
And as a follow-up to, we are seeing some very large cities that are opening up, like Toronto for some curbside pickup. But there are still, again, high number of cases there, more so than in other places of the country where they are not reopening yet. Even New Brunswick had pushed back some days of school opening. So are you concerned about this perhaps imbalance of openings that we're seeing across the country?
Well, thank you very much. I think that each jurisdiction is using the guidance framework that the provinces and territories with the Prime Minister worked out to make their own jurisdictional decisions based on the complexity of considerations that Dr. Tam has outlined. These are difficult decisions, and of course, premiers and local politicians are weighing decisions about how to resume some functioning of their communities while also protecting people's wellness. And I think, as Dr. Tam talked about, the decisions are being driven through epidemiology that's very local in its context and through a risk assessment process at the provincial level. And I think when Dr. Tam talked a couple weeks ago about the downside, coming down the curve, coming down the peak, I think that's where we're at. I think all premiers and all municipal leaders understand that there will be a period of adjustment and that we will have to be taking these decisions, carefully monitoring the outcomes of these decisions and adjusting them. And I think we can anticipate that there will be adjustments as we go through the next phase. Because, of course, this is a whole new way of behaving, not just for leaders, but also for the citizens that live in those communities. I think there are some very simple messages that Canadians can take with them always, no matter which jurisdiction, which is wash your hands, don't go anywhere if you're sick, and make sure you keep your distance, your 2-meter distance from people, and give people distance when you're out in the community. And I think that will help also to reduce risk for community. Thank you.
Tonda?
Good morning. Minister Freeland, the Premier of Ontario, Doug Ford, on Friday was very adamant. He doesn't want to see the U.S. border reopened anytime soon. Can you address his concerns about that, and given that the agreement, I guess, comes up in a week? And very specifically, he said, and if you go about relaxing restrictions at borders for travel, there needs to be tenfold screening at airports and whatnot. So what plan has your government got in place to address those concerns?
Thanks for the question, Tonda. We had a very good conversation with the premiers on Thursday at the now weekly First Minister's call about borders in general and the Canada-U.S. border in particular. We are really daily, even hourly, reviewing and working on and monitoring the border situation with our U.S. partners. The Prime Minister was very clear today, as he is every day, that we believe in acting out of an abundance of caution, that we believe it's very important not to squander the gains that Canadians have sacrificed so much to achieve. And we are going to be taking that prudent and careful approach when it comes to reviewing our border agreement with the United States. The premiers, very much including Premier Ford, offered some very useful input in the conversation on Thursday, and we're having ongoing conversations with the Americans.
I'm not sure that was an answer, but okay.
Tonda, actually, that was an answer. What I said was that we are working closely with the Americans, that we're taking a cautious and careful approach. And we had a great and very useful conversation with the premiers who, by and large, share this cautious view.
So is there a need for tenfold increase in screening at borders, as Premier Ford
when it comes to the second part of your question, actual measures that are in place at the border, right now the situation is working well. In fact, I think particularly at the Canada-U.S. border, the distinction between essential and non-essential travel has managed to achieve our two objectives of keeping Canadians safe and at the same time allowing those essential goods and services to continue moving freely across the border. So that has worked and that is working. Of course, inevitably, as our economy starts to open up, something that we've been talking about today, even absent a single change in Canada's border restrictions, we will see more travel across the border. We'll see more Canadians choosing to go back and forth, and we'll see more business activity, which will mean more essential travel. And that does mean that the federal government will need to do even more at all of our borders to keep Canadians safe and well. And that is something that we are working on right now and we're very focused on.
Thank you, Deputy Prime Minister. We'll now go back to the phone for 3 questions. Operator.
Thank you. Merci. Our next question, notre prochaine question nous vient de Hélène Buzetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour, Monsieur Duclos. J'aimerais revenir à la charge avec la question que vous a posée plus tôt mon collègue de TVA. Cette idée que, on est en train de rouvrir l'économie, il y a des employeurs qui rappellent leurs travailleurs et il y a, dans certains cas, des travailleurs qui eux, personnellement, trouvent que ce n'est pas sécuritaire de le faire. Je comprends que vous invitez à avoir cette conversation entre travailleurs et employeurs sur la sécurité de travail, mais au terme du processus, si l'employeur et le travailleur n'arrivent pas à la même conclusion, que le travailleur veut toujours pas rentrer au boulot, devrait-il recevoir de la PCU, oui ou non?
Bien, merci pour la question. Et je le rappelle, la prestation canadienne d'urgence est là pour aider les travailleurs dans 3 séries de circonstances différentes. La première circonstance, c'est que si ce travailleur a perdu son emploi en raison de la COVID-19. La deuxième, c'est si cette personne a besoin de prendre soin d'un enfant à la maison. Et la troisième, si cette personne-là a besoin d'être à la maison pour assurer sa santé et sa sécurité. Et c'est là-dessus que la relation entre le travailleur et l'employeur est absolument essentielle. L'employeur a la responsabilité non seulement de garantir la santé et la sécurité du travailleur dans son lieu normal de travail, mais aussi de s'assurer que ce travailleur a le sentiment et l'assurance que cette sécurité et cette santé vont être maintenues. Mais dans tous les cas d'espèce, cette assurance et ce sentiment dépendent d'une conversation importante entre le travailleur et l'employeur. Et comme je disais, cette conversation peut avoir besoin d'être appuyée par des directives et l'accompagnement de gens comme la santé publique, des experts en matière de santé et de sécurité au travail partout à travers le pays, certainement au Québec. Donc, ça dépend beaucoup des contextes individuels.
Ben, écoutez, je constate que vous répondez toujours pas à la question. Alors, je pense que je vais pas perdre mon temps à vous relancer parce que je vais avoir droit à la même chose. Donc, j'aimerais vous entendre sur la PCUE pour les étudiants. Le projet de loi adopté il y a presque 2 semaines de cela laissait une certaine latitude. On promettait dans la déclaration qu'on allait mailler les étudiants aux emplois disponibles, qu'on allait peut-être revoir le plafond de rémunération qui est permis tout en touchant à la prestation. Est-ce qu'il y a des développements sur ce sujet?
Bien, 2 choses rapides. C'est que, la prestation canadienne d'urgence pour les étudiants est une prestation qui est offerte dans un contexte beaucoup plus large, avec des mesures solides pour augmenter les disponibilités d'emploi pour les étudiants. On sait que beaucoup de ces étudiants vont avoir de la difficulté à se trouver un emploi. Ils aimeraient en trouver un plutôt que de recevoir la prestation canadienne d'urgence pour les étudiants. Et par conséquent, on a mis en place des mesures pour appuyer des stages, des mesures pour appuyer le travail bénévole, autrement bénévole des étudiants pour appuyer les organisations communautaires, les assouplissements pour le programme d'emploi Été Canada. Donc, une série de mesures qui vont être là pour accroître le stock d'emplois disponibles, mais il y aura des étudiants qui n'auront pas cette capacité de travailler durant les prochains mois. Donc, la deuxième chose qui va être bientôt faite, en collaboration entre Mme Leboutillier, ministre du Revenu, et Mme Quatreau, ministre du Travail, c'est d'annoncer sur un site là, qui va être sur une page qui va être sur le site de l'Agence de revenus du Canada, les détails et les mécanismes pour que ces étudiants puissent recevoir la prestation canadienne d'urgence pour les étudiants.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Laura Osman with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. This question is for, I think, Minister Hajdu and perhaps Dr. Tam. Some experts have expressed some concerns about the way Canada gathers important health data, particularly related to deaths that could be causing a delay in getting important epidemiological data, like excess deaths, for example. Death certificates are done on paper in some areas. So why is this process so behind in Canada, and is it hindering Canada's ability to gather that important data that other countries seem to have ready access to?
Yes, so we are in the process of looking at that kind of data with Statistics Canada because it's not just about COVID-19 deaths. It's also looking at some of the other impacts. So that is actually something that is taking place. As well, we are in contact with coroners and medical examiners to look at what they can contribute to as well. We started that building that capacity as part of our ongoing crisis in terms of drug-related poisonings and overdoses. So we are going to try and link with that platform as well. But it's a very important point, and there's a number of pieces of data that we're looking at right now to look at those in parallel or unintended consequences.
Laura, follow up.
Thank you. Other countries seem to have a more automated process for getting this kind of information. Is Canada's platform sort of behind the times on this?
Well, I think we have highlighted some of the gaps in sort of real-time information on the COVID-19 deaths themselves. So I think we are doing our very best with the provinces to try and see if we can address those gaps. So I think that's clear, particularly in the area of disaggregated analysis that we've already talked about, I think in the last several days. So that is something that we do have to work with. But I think with Statistics Canada, we'll look at some of the other statistical analyses and
analysis by someone in Toronto that in Ontario, private or for-profit long-term care homes have had significantly more deaths from COVID-19 than public ones. I'm wondering what you think of that, and if in the the reviews of our long-term care system and how we care for vulnerable people in Canada if looking at changing the way that for-profit care is allowed, whether that would be bringing it into the public system, if that's something that you think should be looked at and done.
Well, thank you very much, Alex. And I think I've been really clear that there is this health crisis has really shone a light on some particular vulnerabilities in long-term care. And obviously data is starting to emerge about certain characteristics of long-term care that have created even more risk for people that live there. I think our government is very open to reviewing how long-term care is delivered in this country and working with provinces and territories to strengthen quality of life and safety for seniors that live in congregate living settings. And I would say all congregate living settings, although there's a heavy focus on long-term care, there are other groups of individuals that live in congregate settings that also are vulnerable and have, in some cases, substandard care. I'm thinking people with disabilities, for example, or other special needs that may be supported in group settings. But in particular, in terms of long-term care, I don't think there is a minister amongst us that would disagree that we need to do a better job and that the federal government can play some leadership role in this. And we are having those conversations as we speak. How we, not only in terms of how we renew that system in the future, but also how we better support long-term care right now, regardless of how that care is delivered or under what model, to ensure that seniors are safer in their homes.
Alex, follow up?
Yeah, just does that what those discussions include looking at bringing them into public health care or bringing them out of the Canada Health Act? I know the NDP leader is calling for that. Would that be something that you guys are looking at?
I think right now the first focus is to get through the crisis and protect seniors who are in these homes, regardless of the model, in a much more robust way, working in partnership with provinces and territories. And that's exactly what we've been doing, as you know, whether it's through support through human resources. The military is actively involved, as you know. We're working with the Red Cross and supporting the Red Cross to deliver services through the provision of personal protective equipment or helping care homes to acquire personal protective equipment, etc. I think the longer conversation is what do we need to do collaboratively with provinces and territories to move from a place of guidelines to a place of standards. And I think that's the important conversation that needs to happen. I would say right now we are so focused on the urgent, immediate need to save lives in these places that we are not having the fulsome conversations about how to reform the system, but it's certainly on our mind. And I know that it's on the minds of the premiers of the provinces and territories as well, because as I said in my first response, this COVID crisis has shone a light in an area that needs dramatic reform.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. Merci. Thank you.
Bonjour tout le monde. Good morning. I'd like to begin today by recognizing that this is National Nurses Week. Nurses are the heart and soul of our healthcare system. Every day they do incredible work to keep Canadians healthy, and the way they've stepped up to support people during this pandemic speaks to their compassion, resilience, and dedication. To all the nurses out there, thank you so much for going above and beyond, not just these days, but every day. Je veux commencer ce matin en soulignant la Semaine nationale des soins infirmiers. Les infirmières sont au cœur de notre système de santé. Tous les jours, elles font un travail extraordinaire pour nous garder en santé. Et la façon dont elles appuient les gens durant cette pandémie témoigne de leur compassion, de leur résilience et de leur dévouement. À tous les infirmières et infirmiers, merci pour tout ce que vous faites, pas juste ces jours-ci, mais à tous les jours. Since the beginning, our response to the COVID-19 pandemic has been driven by three fundamental objectives. The first is to keep Canadians safe and ensure we take every possible step to protect our most vulnerable citizens. This work continues daily, guided by our best doctors and medical experts, and it drives every move we make. The second